Welcome to Face to Face. This is a show about change and what's next. It's a show that asks questions and peels back the layers of our average everyday experience and goes beyond scratching the surface. We interview people doing incredible things who are making a difference around the globe. Join me as we listen in and get one step closer to understanding that big ideas shared create collaboration. Collaboration can inspire community, and communities create social change. I'm David Peck, and this is Face to Face. So the next interview is with a young woman who I've actually never met face-to-face, but we've met digitally through email and online. Her name's Kelly Hadfield, and she is a bundle of energy. She has incredible amount of passion for the work that she's doing. She's currently somewhere in Ireland. I think she described it to me as living somewhere like right out of the Lord of the Rings, the Shire, which sounds pretty inviting. And you'll hear a little bit more about what she's up to there, going to school, I think working on her third degree. So you kind of get a sense for the type of energy and passion and commitment and intention we're talking about here. And she talks a lot about the Global South, but very specifically about a country that she has a great deal of love for and a concern for and a care for, and that is Ghana. Ghana Medical Help is an organization, ghanamedicalhelp.com. Check them out online. You're going to enjoy the interview. There's a lot going on here, way more going on than meets the eye. Buckle up, listen in, and trust you enjoy this interview with Kelly Hadfield from Ghana Medical Help. Well, welcome to Face to Face. We are joined by Kelly Hadfield today. I think joining us from is it Dublin, Kelly? Ireland? You're in Ireland at least.
Good old Limerick, Dave. Good old Limerick, Ireland.
That's the actual name of where you are.
It is. And so to honor my move here, I bought a dirty book of limericks, actually. I thought it was very appropriate.
Excellent. Well, thanks for joining us today.
No, it's my honor to be here. Thanks so much for having me.
So Kelly Hadfield is the founder and executive director of an organization that I had not heard of before, and my bad, Ghana Medical Help. And so I invited her to come on to the podcast today just to talk a little bit about her passion for the work that she's doing, the medical work that she's doing. She's going to probably talk about some of the schooling that she's just turning a new page on as well, and about this organization. So Kelly, and she's just shared her annual report with me for her organization, 5 years in, I believe. Tell us why you're so excited, Kelly.
I'm particularly excited about this annual report and this particular phase within the organization, Ghana Medical Help. Because I remember starting it as this little idea in this village where there was absolutely zero preventative or curative healthcare measures in place. And it's now been 5 full years, and we have volunteers in 4 continents, and 60 individuals work on our projects and make everything happen. And so with this annual report summarizing 5 years of history, we really took the time to honor it and reflect and use the data that we've collected over these 5 years and present it to our donors and to our supporters and to new individuals like yourselves that haven't heard of our organization, to show you proudly what we've been able to accomplish and the change that we've been able to catalyze. And then in a new sense, present the projects that we're piloting this year that are really focusing on preventative healthcare and expanding out a more multifaceted approach to sustainably improving basic quality of health and well-being for rural and remote Ghanaians in northern Ghana.
So Kelly, why Ghana? Why not Burkina Faso? Why not Cote d'Ivoire? Why not Myanmar?
There's a few reasons that go into that. One is simple chance, honestly. I came to Ghana, it was 2010 for the first time, and my voice is not lie. I am very young, and I was even dramatically younger when I went to Ghana for the first time and started this whole endeavor. And I went through a nonprofit called Operation Groundswell, a really fantastic Canadian organization that does international service learning programs for youth. And they're unlike any other that I've ever heard of. They're very critical. So I joined their first ever West Africa medical program designed to teach future healthcare workers about healthcare in a country like Ghana. And so it was that brought me to Ghana, and it was through engaging in their programming, engaging in all this critical, reflective conversation about voluntourism, about medical tourism, about health inequities around the world and back in Canada to here. And, I've always been very engaged in my local community in supporting health and wellness. And this gave me an opportunity to really make an impact in global health and in my global community.
Operation Groundswell, was it a I don't want to call it a holiday. You referred to it as voluntourism. Was it kind of a backpacking trip with a purpose? Is that kind of what it's all about?
Yeah, it was a bit of a backpacking with a purpose. It was a summer in Ghana. The first half of the program in the capital city in the National Teaching Hospital, meeting public health offices, learning about health from a national standpoint. And the second half was in a very, very, very rural village at a very typical rural district hospital, way up right near the border, the northern border, which is Burkina Faso.
Right.
And that's where I was exposed to a doctor, the one doctor, Dr. James Sarkodie, who ran an entire hospital for 90,000 people that had never in its history seen a single piece of basic pediatric equipment. So it was using an adult blood pressure cuff on a malnourished 6-year-old. You're not going to get a reading, or an adult stethoscope on a newborn trying to detect a congenital heart defect. It doesn't work. And they had 6 thermometers for the whole hospital, and 4 were broken from extreme overuse. Like they just had absolutely zero basic medical equipment. And without having those basic equipment resources, the staff had no capacity to effectively monitor and respond effectively, efficiently to changes in patient conditions. So if you had vulnerable patients, pregnant women and children who had any critical conditions, they died. And they were very preventable deaths, very, very preventable. And it was witnessing this, and particularly when a 12-year-old boy named Moses, who was a child in this village that I became friends with, when he died, I got really, really ticked off, genuinely pissed, and I resolved to change it. Like the stubborn person that I am.
It's amazing, when, philosopher Kierkegaard said, you understand your life only when you start to look back, and, you see the dots, you see the connections, you see the links, you see some of the thread. And obviously the death of a 12-year-old boy is going to have an impact, but to see how, a simple sort of, oh gee, I'm going to go on a backpacking trip, how all of a sudden that changes the direction of your life and just turns everything upside down.
Yeah, it's absolutely amazing to look back on those maybe weekends where your whole life made a change, a direction because of a choice. Mm-hmm. And I'll note also with this, so it's based out of northern Ghana. Currently, the most northern 2 regions, they have regions as we have provinces. So it supports 2 million people now. But we're expanding beyond Ghana, not physically, and these are our goals for the coming years, really. But GMH, Ghana Medical Health, because we're very, very research-based and we're very, very community engaged. And in northern Ghana, it's very stable politically, and there's no corruption, but there is this need. So we found actually a niche of ours is to work as a gold standard model to demonstrate on-site proof of impact of a project that can then be replicated and reproduced around the world in all kinds of resource-limited rural contexts.
So the whole the medical help thing. So clearly, Moses, the 90,000 hospital serving 90,000 people without the proper blood pressure cuffs, etc. I mean, you're speaking in a way that I wouldn't. Do you have are you a nurse? Do you have a medical background, or did you just get sort of thrown into this and said, okay, this is unacceptable. I now need to learn everything I can about this, and now you're becoming a doctor, I believe.
I am becoming a doctor now. This will be my 3rd degree.
That's hilarious. Your 3rd degree.
I've been for, I think, about 15 years in total.
So you're hang on, Kelly. You're like a professional student then.
I am the definition of a professional student. Yeah, but it's been a lot of adventures. I did my undergraduate degree in Biomedical Science at the University of Guelph. During that time, I was trained for 3 years as a peer counselor. and got very in-depth exposure through that to mental health illness and quite a passion for it. And through that, exposure to issue and health equality in certain kinds of marginalized communities at home and abroad. And I did a master's degree at the University of Guelph in integrative biology, but it had a large global health component, and that a lot of it was based in East Africa. The field work was all looking at a novel technique for doing large-scale monitoring of malarial mosquitoes. So that was a fantastic project that greatly enhanced my research and critical thinking skills, which is an essential component to project development for something like running this charity in Ghana. Because it really avoids a lot of simple pitfalls that you get with a lot of charities in countries all around the world and at home, because people often don't use a research-based approach. They don't ask if what they're doing is needed. And if they do ask, sometimes they don't always listen. And a lot of projects don't often follow up afterwards.
Yeah.
And that's really, really critical. You need to not only have a baseline data before you begin, but then you need to have defined measurable outcomes that you monitor for periods of time afterwards. And then as well, you need an exit strategy. You're supposed to be capacity building. Charities come and go all the time. You need to be able to empower locals.
I couldn't agree with you more. I think one of the biggest failures, I think, of the development sector, maybe it's from a donor perspective more than anything, is certainly bigger government and bilateral institutions, multilateral institutions. They want results in 1, 3, and 5 years, but which, on one level you go, okay, I get that, and you gotta put it within a framework. But then what about the 10-year mark? What actually occurred? What about at the 15 or 20? And I don't know how you come up with a mechanism to monitor and evaluate 5, 10, 15, and 20 years in, but I think it's almost essential to really get a better and more sort of robust understanding of long-term change,
Yeah, definitely. And that's actually really what public health, I think, organizations really strive to do and strive to promote, and what we in Ghana Medical Health strive to promote. The concept of really focusing on preventative healthcare. By preventative health measures, those you see the impact over long periods of time. Definitely not within 5 years. You see them after 10 and 20 and 25, like you're saying. And so, and in order to create any change, especially in health, you need the politicians and the media on your side. And you don't get the politicians and media on your side if you're focusing on something that won't materialize for 20 years, even if it's going to dramatically change the whole lives of a country. So yeah, it's really interesting. In our organization, our projects, we've struck a really, really good balance of projects that focus on preventative and curative care. So we try to make everything focusing on preventative as possible, preventative medicine, but where it's essential, because there's no medical infrastructure in a lot of these areas we're working in, there has to be some form of curative healthcare focused projects as well to fill in the void, so that if a baby desperately needs oxygen, it can have oxygen and it can survive. Before, a midwife told me this winter, they would know a baby needed oxygen because it would turn blue, and then they had no way to give it oxygen. And now they'll know well before it turns blue it needs oxygen because it's hooked up to one of our pulse oximeters, and they'll have the appropriate sized oxygen mask and oxygen tubing and an oxygen concentrator to give it its appropriate therapeutic measures.
So there's never a simple answer to any of these issues. It seems to me very complex, very nuanced. I mean, extreme poverty, it's not just one thing. It's not either or. It's not a dualistic kind of thing to understand and to actually sort of attend to. But having said that, do you think infrastructure is really what it's all about as far as the global south is concerned, and building infrastructure up is where change is really going to occur?
Oh, 100%. Yeah, there's absolutely no doubt in my mind. Capacity building up infrastructure, and that involves then collaborating with the locals, whether it's in a country that has no formal infrastructure, and then you're working more with the local chiefs and the local councils, or whether you're working in a country like Ghana, and so you're working a lot with Ghana Health Services, as well as the local district assemblies. That's why that's so essential to really ensure that you're building up their capacity and that they're the ones who are empowered and they have ownership over the project. And then they're also accountable for the projects. They're engaged and they're counting their own resources and energy into them, which ensures their sustainability and ensures that they're going to be invested in wanting to maintain the outcomes and maintain the impact on the local community. And they can take more pride in the impact. They're the ones that at the end of the day are able to say, we made this happen. And that's what we want them to say. With Ghana Medical Health, I'm happy to just be in the background and kind of don't take any credit for it, because that's not the point. The point is really to empower the locals to save the lives of their neighbors and to do that for 20, 50 years.
So Kelly, why were you so pissed off? So in other words, what is it that's driving you? Because I reflect on, why do I do the work that I do? Why am I involved in international development? Why do I care about social change? Little things making a big difference, etc. What is it that's, I don't know, what's got the fire lit below, your feet?
Well, there's lots of really important causes and to get behind. There's environment and there's politics. There's so many different causes to support and that are worthwhile. But with me, I find when human rights are in a way being violated, and when there's a major social justice that takes away from someone's basic health, basic right to health, ultimately, I get infuriated. And it's that divide then in kind of and health status of certain populations, marginalized communities, say, whether they're immigrant or whether they're homeless or whether they have mental health illness issues or whether they're born in a different country. And in Ghana, it was this boy I'd made friends with, Moses, just a lovely little farming kid, who on the third day when the staff thought he was improving, died 2 hours later because there was internal bleeding that they weren't aware of. I knew that he never would have died in the most basic facility in Canada. And the fact that he died was really because the staff had no idea that there was this issue. And in a critical window of time that they would have had to respond, they weren't able to respond because they didn't know this was happening. And he died. And that would have been caught back home. And so the idea that I knew in my heart he never would have had to die if he'd been born here. And so the fact that he was born in this village called Sandema, did that justify and make it okay that he can die here, but a child his age would never have to die back home in the same case? And the answer was no, of course not. And I knew that resoundingly in my heart, and that was what really infuriated me. And it was compounded also because there's an orphanage, an amazing, amazing boys leadership, really fantastically run orphanage called Horizons Children's Center in Northern Ghana. It's also actually Canadian founded. Really fantastic organization. And if I wasn't, every minute I wasn't at the hospital, I was with these 25 boys at this orphanage who are really, they do a lot of leadership development. These are the most respectful, intelligent, absolutely incredible boys. And I got really close with them, and they were all about the same age as this boy Moses who died. One of them, his name's Moses, and he's one of my really good friends from And the idea of one of these other boys getting sick and dying because of inexpensive, basic equipment not being present, like tongue depressors cost less than $10, thermometers cost $12, stethoscopes I can get for $20, like cheap things. The fact that just because they're absent, one of them might die, I could not handle the thought. And I still can't handle the thought. That can still drive me really easily to work when I'm tired. And that's why I did it. There was no other way for me to go about it. And the fact that I was young then really helped, because I didn't have any, when I then sat around and thought, okay, how am I going to do this? I didn't have any mistaken thoughts of kind of arrogance of being an expert in something. I knew that I knew nothing. And I also knew that I wasn't a Ghanaian. And those were two really important realizations, which kind of established the roots of the charity that grew into something really incredible.
I still find it fascinating when I hear somebody like yourself who's got the passion, who's got the commitment, and the desire, and also the active ability to make it happen, clearly, because I think there's a real disconnect between wanting to do something and then actually making it happen, right? As we both know, why still though, why is that? Why is it, and we don't need to go any deeper than that because but I'd be happy to chat about it more. What is it that motivates you to care about human rights? What is it, you and not someone else? I find that really fascinating because I had a conversation with somebody this morning whose focus is the environment and took a very hopeful approach. And that, I think people do care, David, and here's why. And, I'm a hopeful cynic, Kelly. So
Yeah,
I'm
so
not,
am I.
I'm not convinced that everybody does care, but I think, maybe the backpacking trip is what did it for you in a sense, hand in hand, side by side
No,
with Moses. And, but because I sometimes think getting people on the ground could make all the difference in the world. But then, yeah, anyway.
well, with that, I don't necessarily think you need to go somewhere in order to create a change or to make a difference or to have that thought. It's often being inspired by somebody who can instill a recognition in oneself that goes, hey, I can do that. So a lot of people don't recognize that they have a capacity to create change themselves. I'm very fortunate because I'm the niece of Canadian astronaut Chris Hadfield, and he went to space the first time
I wasn't going to bring it up.
yeah, that's fine. But really, he was part of it. He went to space for the first time, and I was 5, 6 years old. I think I was 6 years old. And and then he went again a few years later, 5, 6 years later. And again, I was at that launch. And the event of him going to space and coming down, it actually doesn't stand out in my memory as a huge moment because it was normal. And normalized incredible achievements was really empowering for me because in my mind it was very reasonable to understand that I could do anything I wanted to do because yeah, my uncle goes to space, that's cool.
Yeah.
No,
No.
depends
So most kids are being told to reach for the stars. You're watching your uncle actually reaching for the stars. Yeah.
and so if there was no hesitation in my mind, and then it was reinforced by my family, by my mother especially, who's very big into social justice causes. If there was ever an issue in my community, she would always then just create the small change needed to make it better, to make it happen. She would never wait for somebody else to do it. She would work with others if they're already doing it. But I'm Jewish. My mother's side is Jewish. So during my bat mitzvah, my aunt at the time, it showed that she had a very, very preemie baby, my cousin. And, we saw that women there had absolutely nothing to do. There was no books, there was no movies, there was just nothing for them to do. And they were there for months. So I turned my bar mitzvah into a fundraiser. So all the centerpieces were full of, books and games and word puzzles and all kinds of things that then we went donated to the hospital.
Right.
Like just small things like that were ingrained as really normal. You see an issue in your community, you make it better. And you don't do it with an attitude of arrogance, or you don't do it with an attitude of doing it for yourself. And so that was really where it comes from for me. So I started a charity with my mom in my local community, which is around Barrie, Ontario. Actually in Utopia. It's a forest outside of Barrie. That's where I was raised. And
There's a forest called Utopia just outside of Barrie.
there is, and
Well,
let me
that's
tell you,
awesome. I
I
had
know
no idea.
they did well in the naming. It's lovely.
Yeah.
You got to come out strange when you're raised in a forest called Utopia.
Yeah, no kidding. Well, just coming from Barrie is going to have an impact. I mean, come on, really.
But I actually started a charity there with my mom because I was enraged that the only girls that were eliminated from going to their prom were the ones that deserved to go the most because they were the ones that worked the hardest. Those are typically the girls coming from more marginalized, more low-income families. And those were the ones that typically had to work far harder. And if they didn't drop out to make their lives easier, and they overcame all these challenges that many of their peers didn't have to go through, they were the ones not able to go to prom. And I got really, really angry about that when I saw it happening to my friends. So I resolved to change that. And I started talking to my mom, and we started this charity called the Prom Bliss, which is still operating today, 10 years later.
What's it? Sorry, what's the name of it?
It's called the Prom Bliss. Yeah, Prom Bliss Project. So it's still going. If anybody has a graduating grade 12 daughter who needs a dress, and they're beautiful, a lot of them are designer donated brand new dresses.
Cool.
It's a really, really fantastic initiative as well. But so yeah, I'm engaged in my local community. I get engaged in my global, but the one it usually ties to health. So in high
Yeah,
school,
sure.
for me, that was a mental health thing. It was mental health and wellness. My global community, it's the same. And so as a result of all of this, and when recognizing that kind of unique trait in myself is that I don't wait for somebody to create the change for me. I just forge ahead and create that path, and then others tend to follow. I love engaging youth in Canada. I love giving presentations, really capitalizing on investing in young adults to recognize that they have an ability and a capacity ingrained in themselves to catalyze change. And that change can be in whatever cause they want. And then if I can add on the layer to think global but act local, and the ripple effect that can create, that can induce is
I think, it's really interesting. You use the word normalized, and I like the word normalized in a sense, but I wonder if it's almost, you talk about your uncle, going to as if this was what we do in this family. And this is, it's almost like you start a charity with your mom. I mean, how many people do that? And then I think of my kids and the way we're raising them, and it's a lifestyle kind of a thing, and it has an impact, and it's incremental, and it's over a period of time. And what it does for me is it injects so much import into the littlest things, the simple things, right?
yeah,
Those decisions we make, where we choose to eat, where we choose to go on holiday, how we spend time together. I mean, I don't know, I think there's a profound insight here, actually. And you don't have to have an uncle who's gone to the moon,
no,
right? You
yeah,
really don't. And I think your comment about what did you say earlier? You said, we don't. A lot of people think they don't have the capacity to change the world, or to change things, or to change their own, futures, I guess you could say. In fact, I mean, I have a friend, and I've certainly brought him up on my podcast from time to time. He just doesn't believe in change. We are who we are, and very deterministic, and part of your DNA, David.
oh, he would be great to get in a debate with.
Yes, he's a great guy. I have a lot of time, and I love him dearly for him.
That's great.
I have a lot of time for him, and I love him dearly. But boy, he can be stubborn when it comes to this one. It's pretty comical. Hey, so really quickly, I got to get this out of the way. Have you bumped into Bono or The Edge yet?
No, no, not yet.
Oh,
No,
come on.
unfortunately.
So
No, my
everybody,
eyes are open. But nobody goes to Northern Ghana. That's why we work in Northern Ghana. So I pretty much bump into nobody in Northern Ghana because it's the hardest places
oh,
to
sorry,
stop.
I met in Ireland. I met
Oh, in
if
Ireland. Sorry, Bono. No, no.
yes,
Oh, but Luke Skywalker was at a random pub drinking Guinness a week ago, which
Mark
I thought was
Mark
very cool.
Hamill. Mark
Yeah,
Hamill.
yeah,
Wow, that's
that
I
was cool.
Okay,
Yeah,
Kelly,
he was
so I'm old
great.
enough to say that I just got a shiver up my spine.
Yeah, yeah, it
Yeah.
was pretty. I realized I'm living in the wrong town, but I'm in the right country.
That's right. That's
Um,
pretty fun. Luke Skywalker comes into a
yeah,
local pub.
yeah.
I'm a huge U2 fan, but earlier I thought about it when you were talking about Moses, because I believe, and I haven't been able to pull the copy off my shelf here, but in The End of Poverty, Bono writes the introduction to Jeffrey Sachs's book, and I believe he refers to, don't know if it's his phrase, but he refers to an accident of geography. And
Yeah,
and isn't that kind of what you're talking about,
that's 100%, 100% what I'm
Yeah,
talking about. Yeah.
yeah.
And when health gets compromised, when human rights get compromised just because of an accident of where you're from, it's to me infuriating. And when people kind of justify it or write it off or forget about it a week later,
Right.
that typically also is something that I get a little infuriated about, and then try to just engage people in conversation to make change about it. I like, for example, I'd love to actually give examples of a project or two that we're doing to kind of demonstrate.
Well, I was just
Uh,
about to say, tell me a little bit more about Ghana Medical Help, and I want to ask if you're going to be, are you moving into other countries in Africa? And is that a part of your 5-10 year plan, or what? What's next for Ghana Medical Help?
um, well, it's quite a few questions
Oh
condensed in
yeah,
there.
that's yes. There's about
I'll
six
start with a
questions in
bit of
there, I
what
think.
we're doing at our core. What we began with, and what we have a very strong expertise in, is medical infrastructure, medical equipment infrastructure.
Hmm.
So we began providing the most basic fundamental equipment that enables the staff to be able to monitor the vital signs of their patients, respond effectively to be able to treat them, and especially under critical circumstance. So we spread from that one hospital in Sandema. We made such a tremendous impact there that the neighboring, a half hour away from the Sandema hospital where we began, just 30 minutes, is the Navrongo Hospital, where there's 2 doctors for 200,000 people. And again, just another 30 kilometers down the road is the Bongo Hospital, 1 doctor for 90. So really close proximities, there's this immense need. So we expanded from 1 hospital to 3 to 5 to 10 to now 14, which is every single one in the most northern 2 regions, supporting 2 million people. And each hospital has only 1 or 2 doctors, typically. And that was kind of the roots. That's what we did. And then we branched very, very aware. We work with biomedical engineers. We're very critical of our equipment sources, making sure that we only provide the most proven, durable, robust equipment that's not going to break down, that's not needs to be plugged in. We try as much as possible to get equipment that just needs to be plugged in to charge or is just battery powered. We're really conscientious about being very critical about the equipment we provide to be responsible for that. And that we're only ever providing equipment that each hospital says they need more than anything else. And we talk to all of the staff in all the wards every 3 months of every year since we pretty much started. And in order to do so, we're very community engaged. So we have 30 Ghanaians who are local healthcare professionals from our 14 partner hospitals who are part of GMH, who are doctors and nurses, and they do on-ground research, they do monitoring, they're the ones who we train to then train others. We have a lot of kind of mechanisms in place for that to ensure that our equipment gets well used and well maintained and then well monitored. After we donate the equipment, once a year that happens, we then follow up every 3 months doing impact assessments, again, looking at a macro and micro view to analyze and assess the change that was created. And that's incredible. You see over 300 more patients a day able to receive medical care.
Wow, that's
in
astounding.
hospitals during peak rainy season. Yeah, it went.
And you can actually show that that's directly linked to the
Oh
the
yeah,
quality of the
yeah,
equipment that's being used. I mean, obviously it has to do with training and
and
education and so on as well, but a lot to do with equipment.
yeah, and I can
Wow.
give you a good example why. And so in the past, a hospital might have, a 3 or 4, 3, I think 4 might be pushing it, old Mercury-style blood pressure apparatuses. And they would have over 100 people sitting during market day, during malaria season, for them to see. And you cannot use your one blood pressure apparatus that's designed for OPD where everyone comes in. You can't use it on all those people. So they would physically look at you and guess what your BP might be without taking your BP. And maybe 1 out of 10, only if you looked really sick, would they take your BP with this really old, somewhat dysfunctional BP apparatus. So first of all, they weren't even taking the vitals for most of the people, for 9 out of 10. But then we introduced these devices that are Welsh Allen Spot Vital Signs device. They're really durable. We've had one that we donated in our first year, and it's still working in the Sandema Hospital 5 years later. They just plug in to recharge, and then they can last all day. And they can monitor your heart rate, blood pressure, temperature, and pulse oximetry, so your oxygen level in your blood. And these work in like 4 seconds, and they take all your vitals. So
Wow.
they use them on every single patient, and they sped up efficiency by 30% in that OPD where the patients come. So they can see over 300 patients in a day during peak rainy season. And they can go through their wards very quickly and take the vitals multiple times a day. They can leave it to a patient who's critical to continuously monitor them. Like those kind of things are where, and it's fun.
It's an amazing story. It really
Yeah,
is. Yeah.
yeah. You see really funny things happen too. Like GMH comes in and our equipment arrives, and then there's a huge increase steadily in the incidence of hypertension in the region. And you're like, oh no, it's not that there was more hypertension. It's the fact that people are getting their BP reading. That people can actually get their BP reading, and then they're able to see that hypertension is high. So it's really, really, really interesting to be able to monitor those changes and impact staff morale. That's dramatic.
Oh yeah, no, well, exactly. And you start to see the connections, right? You start to see the implications of a simple intervention.
That's what's always kept me going. Actually, is every 3 months getting a new research survey that's showing across all the wards the impact in every hospital. That 100% is what gives me the high if I was ever feeling burnt out, because I was doing this, of course, while doing different degrees and different things. And then we began to branch off, I'll mention. So what's cool actually with this equipment project is it's actually working, and that's what's
Right,
really
right. That's always a plus when you're talking to donors, Kelly. Yeah.
yeah. Well, like the idea is, of course, that they don't need those items over time, and that they don't need the amount, and they don't need that. And this January, I was in Ghana twice this year, and the goal is to try to not need to be there, right? That's why we engage locals. That's why we have amazing, amazing people on the ground. We call them GMH ambassadors. Um, and so when I was there, though, in January, I saw the hospitals that we've been in the longest for 5, 4, 3 years. They don't need the equipment anymore. They don't need any of the basic stuff. They might need some of the more comprehensive stuff, like an oxygen concentrator or a suction machine. Those secondary kind of comprehensive equipment needed to kind of do more life-saving procedures, they're not still expensive, not at all like an X-ray. We don't deal with any of that, but they're life-performing equipments. They used to have none, like not a single hospital in the Upper West region for 1 million people. There was no oxygen concentrator. Like it was appalling. So then we brought in one, but one for a whole hospital means it's going to be overused dramatically. It's going to be, taken multiple different wards in a day. So they still need a few more things like that, but they don't need, almost anything else that we were supplying before. And our newer hospitals, we're able to start even weaning them off now. And so it's been cool to see this transition of, the project model is working. They don't need those items, and they don't need the quantities, and they're not asking for them. They're not greedy,
Yeah, and I think that's a pretty interesting statement, because they must, the local Ghanaians must really, I mean, obviously are seeing the significant impact these things are having. What about local government? What about you say there's no corruption? Is it just a lack of funds? Is it a lack of
Yeah.
or is there a what else is going on there? Why aren't they getting access to some of this basic equipment?
Yeah, it's a lack of funds in general. It's a lack of investment and desired investments. And there's a lot of stigma about the North in Ghana. The infrastructure is extremely poor. There's pretty much one road that goes through the one province and another road that goes through the other. There's extremely high levels of poverty. There's very poor resources for education. It's really it's as far as you can go from the economic centers of the country. And so as a result, you just don't see investment. You don't see, the government putting any resources in developing, or very minimal. Maybe now because elections are coming up next winter,
Right.
they're building a few more roads, and they're taking the money that's saved for the hospitals into those roads. Right now, there's several complications in the healthcare system. They had a great development 10 years ago called the National Health Insurance Scheme, NHIS, and that pretty much gave, for $12 a year, you and all your children under, I think it's under 16, might be under 18, I think under 16, access for free healthcare for about 95% of things.
Right.
Pretty much anything generic that you come to a hospital for, it covered you. And it was tremendous. It dramatically boosted especially in rural health centers, rural hospitals. It really, really boosted the number of patients coming in to seek medical care. However, there is corruption in that, and some of the funds that were supposed to go to reimbursing the hospitals haven't been going, and now it's created a stalemate so that the hospitals actually don't have funds to buy consumables anymore, and so actually one of the doctors at Bonga, one of our hospitals, said that if it wasn't for GMH, they would have walked away years ago. That they haven't gotten equipment like from the government or from a regular source since 2005. Some really, really interesting things. But yeah, so as a result, we've had to really branch off as well, of course, into other projects.
Yeah, sure.
That's not enough.
What about we're probably going to need to wrap it up here in a couple of minutes, but tell me a little bit about what's next. I mean, have you got a big event coming up in Toronto, fundraising? Are we going to see GMH on the side of a rocket anytime soon, heading to That might not be a bad fundraising campaign.
Yeah, if somebody wants to donate the money to set that one up, that would be great.
We'll talk to NASA about that, Kelly.
Yeah. Well, we have a lot of really, really exciting things on the horizon. We have a lot of really amazing new projects. For the last couple of years, in addition to the equipment, we focused on developing education and medical skills-based training workshops for local healthcare professionals. So we train the trainers to train hundreds of rural healthcare workers, which is excellent and something we're really focusing on continually develop. Because right now, a pediatric nurse won't know how to do CPR on a baby. So we really focus in on improving those skill sets. Every 3 months, we do these workshops to propagate out that new kind of training level, especially in remote health centers and rural health centers. We have a really great project that we had a successful pilot, so we're growing out, that is part sustainable income generation as well as public health education. So we actually work in the northern regions here. Almost everybody's a farmer, a small-scale farmer, and very, very high levels of poverty, especially as you go more remote. And so we actually have this really fantastic sheep lending program that a beneficiary farming family will get this pregnant female sheep. After 3 generations of reproducing, they give one back, and we pass that on to a different family in the community. And they're very, very high value, so they generate more funds than they'll ever see in a decade in their lives from one sheep being sold. And with this, in order to be a beneficiary family, you have to attend a bi-monthly workshop that's part asset management and part public health education. And this is really, really exciting because in this project construct, we have so that those who are being benefited by this project now and who are partaking in these workshops are going to end up being the leaders of these workshops years from now, who then branch it off. So as you get the ripple effect across the regions, you have also the sustainability to the education component. Very exciting. I'm really happy with that one.
No, it's amazing. It sounds like. Well, listen, thanks for joining us today, and I got to say congratulations. So is it 5 years? Is that what the annual report was kind of the anniversary of?
We're going to 6, and as you mentioned, we're having this inaugural great flagship fundraiser with my Uncle Chris in Toronto at the X on November 21st. I'm hoping to promote it as much as possible because it's going to be glorious, and we're trying to bring Ghana to life that evening. We have amazing displays. We have an incredible photography exhibit by a famous Canadian photographer, Curtis Camo, who came to Ghana this summer. We're going to have a lot of really exciting things there, as well as it'll be a great intimate evening with my uncle, who will, of course, give a presentation.
Right, excellent. Are you coming back for that?
There, and thank you so much again for this opportunity. And
you're welcome. And are you gonna be in Toronto for the event?
I am flying back from Ireland for 24 hours in order to come to this event.
Yeah, that's you're going to pay for that, I think, in a variety of ways. But that's but my sense is your level of passion will be able to attend to it accordingly. How's that? Hey, Kelly, thanks a lot for joining us today. Really appreciate your your desire to move things forward and your belief in the little things and in change and all that. It's really it's compelling, it's challenging, it's affirming and encouraging and a whole lot more. So thanks a lot for your time today.
No, thank you, Dave. It was absolutely, again, it was a privilege, and talking with you, hearing your feedback, it's fantastic. I hope to do it again sometime.